Dr. Dan Eli, an obstetrician and gynecologist. Abnormal uterine bleeding, which other doctors would call as menorrhagia, or heavy uterine bleeding, is a very common condition. There are many causes of abnormal uterine bleeding, especially in non-pregnant women. Some of the problems are structural, others are functional. The structural problems involve polyps within the uterus, adenomyosis, and then if somebody's had a malignancy, if somebody has had leiomyoma, which we commonly call as fibroids, those are the commonest structural problems that lead to bleeding in pregnancy. Meanwhile, we have cases of people who have coagulopathy, which really refers to abnormality in clotting system. There are people who generally have defects in certain clotting factors. In situations like that, they may be able to bleed much more. For example, after their period, they continue to bleed much more. Meanwhile, there are those who have problems which are endometrial in nature. Either it can be due to infections in the uterus, which you call endometritis, or they may be having endometriosis, a condition where endometrial tissue is located elsewhere. Meanwhile, there are also those who have a problem related with ovarian dysfunction. So when there's an ovarian dysfunction, there's a tendency for uterus to at times bleed, because most effects of the ovarian hormones are exhibited also in the uterus. Some conditions and some situations we may not know the causes of the bleeding, and then in rare cases we also have cases related with the iatrogenic factor, which is really referring to an injury caused either by a medical intervention. Thank you.